This is the Chapter 15 lecture. It covers the future of healthcare delivery and health policy. We are not going to cover Chapter 13, Healthcare Management, and Chapter 14, Health Information Technology, since there is a course dedicated to each of those subjects at the college. Okay, so this is a looking forward, and there's some optimism from your authors, but there's also a good deal of caution as well. Their predictions are listed here. This is not a long chapter. Take time to really read it and think about it. It is expected that science and knowledge will have some major breakthroughs. There will be major changes in payment approaches, which probably doesn't surprise any of you. This is very, very needed. There will be movement toward integration of medical care organizations, and of course, political dynamics, as always in the United States, will become important in terms of the direction of our healthcare system. The discussion of new knowledge and technology is fairly exciting, I think, in this chapter. The belief is that it will just become faster and faster. We expect to see human genome sequencing and the ability then to tailor recommendations to your particular genetic code. We expect to see more stem cell research and robotics use in medicine and even artificial intelligence. On the cautious side of things, income disparities in this country have only grown, so who will benefit from these exciting developments? Will they be available to all? That certainly would strain the budget. Okay, those advancements are always expensive. Or will they only be available for those who can pay for them? There is potential always in the future. And with regards to the healthcare system, there's the potential of creating a more vibrant culture of health. As someone who's been involved in preventive health and lifestyle and nutrition, this is something I think of as very, very exciting. We need to see changes in lifestyle in this country. We need to address the health of the population as a whole. We return to the triple aim in this chapter. The triple aim is to improve the patient experience, the health of populations, and reduce the cost of care. We will be increasing the aging population in this country, and you can see that it will take a much bigger piece of the pie. And because of that, there will be more chronic conditions to care for, more of a need for long-term services, life-expanding services, end-of-life services, and we expect to see shortages in trained providers as well. How our care will be delivered will be very, very interesting. Will we see these integrated networks bringing improved patient outcomes? Will we see improved efficiencies that we've read about in this textbook taken to a large scale? If we grow bigger and bigger health systems, will competition be weakened? And will we perhaps raise up or elevate or highlight these centers of excellence as models for care? Disruptive innovation is discussed in all matters of business. We see pop-up changes in healthcare that then become part of the system. The rapid spread of urgent care centers, telehealth, for example. Will we see more disruptive innovation? So the key challenges that will receive attention in the upcoming years are, of course, improving financing and insurance. Helping people lead healthy lives is urgent. We cannot sustain our healthcare system if we become less and less healthy. Addressing the cost problem, improving quality outcomes, and the patient experience. So, for different stakeholders in the health enterprise, this means different things. If we look at providers, the effect will vary depending upon the provider type. There may be decreased incomes or slowed income growth. These providers may become more politically active. They may seek more market and organizational power. And of course, they will need to adapt. The world is changing and the healthcare system along with that. Employers, they may continue to offer insurance coverage, but they'll want to limit medical care liabilities. Of course, like we read about with or learned about with Safeway, encourage wellness activities so that costs decrease. And in the effort to lower costs for the business, add higher deductibles for their employees. So the employees will feel the cost of healthcare more in the future. They may also exit their role in healthcare. Insurers, there will be competition, and they will need to provide services related to insurance operations at health systems. And our policymakers. So, what will our government officials be doing? Of course, Medicare and Medicaid costs preoccupies a lot of the thought around health care. They will need to address concerns over an aging population, continue the debate over the government's role, varied approaches to expanding Medicaid in states. So, will Medicaid continue to expand? And of course, consider new organizational and reimbursement approaches. I would add to this that post-pandemic, they will have even more on their plate with regards to the healthcare system. Consumers will look for more advocacy groups. They want to be more involved in shaping policy. And we'll need to make some tough decisions about cost versus benefit of healthcare plans. They will need to consider whether they would like to pay lower premiums and have higher deductibles and how that will influence their use of healthcare. Thank you.